Typically, people will see us when their shoulder symptoms are no longer controlled by home or over-the-counter remedies. Things like anti-inflammatories, stretching, exercise program. At that point, it's usually wise to see an orthopedic surgeon who specializes in shoulder surgery.
And those patients will usually present to the office with some form of chronic pain. They've had pain for many months to many years. They'll oftentimes have limitations in motion and function, pain with daily activities. Very commonly, they'll have difficulty sleeping.
And shoulders are interesting because they usually come at nighttime. A lot of night pain, it's just this toothache that keeps you up. And so if you're getting to that point, then life just isn't much fun.
Other symptoms that they may notice is what we call crepitus, or grinding or feeling of popping in the joint while you're moving your shoulder, which is often painful, and certainly limitations in motion, the inability to reach higher up into the cabinets can be an indicator of both shoulder arthritis and sometimes rotator cuff tears.